This is Gary Rogers, Noggin Doctor. Again, we're going to continue on our 15 myths in Plagiocephaly and torticollis, and this one may be the most relevant of all. The one that I probably should have covered first is the idea of how plagiocephaly and head flattening will affect your child. So this is a question we get from parents all the time. I mean, the biggest issue really is this going to be a long-term issue in some way, medically, functionally, or aesthetically? And parents are looking for answers on that. And amazingly, there's not a lot of studies in literature that document this. There are some. With brachycephaly, there's been studies that have shown long-term brachycephaly that people really don't consider it a problem, and that people adapt very well and have normal psychosocial profiles. And so there is some of that. Plagiocephaly, most of the studies show that plagiocephaly improves with time. In fact, many of them discuss the idea that it goes away or goes down to a very negligible number. The reality is, and studies show this, is that the flattening probably doesn't, after 4 or 5 months of age, change much, but the head gets bigger. So as you watch a child grow from 4 to 5 months when the flattening peaks, out to 3 years, 8 years, 10 years, of course the head's getting bigger, and the flattening as a proportion of the total head size diminishes. So there's a relative improvement in the way this looks, and this has been borne out by scientific studies have shown this over time, that the CVAI, which is a ratio that captures the flattening versus the total head size, keeps dropping down. With that said, if you look at studies, there are CT studies, there's actually 2 of them in the literature that show that if you look at adult and older kids' CT scans, you'll find that about 12% of those people have a CVAI, so these are adults and older kids, CVAI of greater than 3.5%, which is actually clinical plagiocephaly. So it's still out there. They still have some. It's still visible, still arguably measurable. The question is it visible? And that's the part that we can turn to our own empiric experience to answer, is it visible? Have you ever seen an adult walking around with a visible head asymmetry? And the answer for most people is no. Not that they're not out there, it's just that when you're looking at people from a posterior side view, the idea that you can see that disparity between one side and the other is not so accurate. They're very, very challenging. If you're looking down on a head like you do with an infant, of course you can see that. The analogy I use in a lot of my papers is like looking at the Empire State Building from a helicopter. If you're looking straight down in the plane of the asymmetry, you can't tell that the Empire State Building is much bigger than the adjacent buildings. It's only when you move to the side that you can actually see the disparity in height. And that's analogous to head flattening, is that when you're looking down on the patient's child's head, you're going to see the disparity much more accurately. When you're looking from a posterior side view, it's much more challenging to see. So that relative improvement, so to speak, it's not necessarily absolute improvement, relative improvement is a big mitigating factor for what happens with plagiocephaly. If you look at brachycephaly, I would challenge you to look around at people and especially in other parts of the world. A lot of people have brachycephaly. A lot of adults have brachycephaly. The way that looks, if you look at the back of their head, they have a very flat, their literally top of the head goes almost back down into their neck. There's very little rounding back there, and then they also tend to have some compensatory broadening. So it's a zero-sum game. If your back is a little flatter, your sides are a little broader. So if you look at my head, I have a thinner head, I have a pretty round occiput. That's the classic kind of front sleeper Western head pre-1992. As we went to back sleeping, of course, heads got a little broader. We have a lot more people with a little more flattening in the back. But the question I have, again, for parents is, how many of these people do you actually notice? And on our Facebook group, we often talk about this, and people say, my gosh, my husband has this, or my boyfriend has this, and they'll show pictures, and yeah, that is what it is, but they never noticed it. The boyfriend never noticed it. People really don't appreciate that. So I think when you look at the aesthetics of this long term, we can safely say that it's rare to see somebody in the population that you look at their head shape and you're so taken aback that it would draw your unwanted attention. So that's the aesthetic piece. Let's talk about the functional piece. There is zero evidence that deformational flattening causes any kind of developmental delay or cognitive impact. That's been promulgated many times. The association is there. There is an association between head flattening and developmental delay, but that's because kids with delays can get flat. Anything that limits mobility early on can cause flattening to develop. And so it's the the chicken and egg thing. It's really the chicken then the egg, right? Meaning that the developmental delay happens, and then kids who have delays can get flat. Not that the flattening causes delays. The reason we also know that empirically, even if you didn't know anything about the literature, is that if you look at countries they've been back sleeping historically, parts of Asia, parts of Latin America, Eastern Europe, there's no evidence that these people have substandard intellect or cognitive function, or the people that are affected by this, it's not everybody, have less intellect than people who don't. If you also look at empirically at 1992 Back to Sleep campaign, we saw a massive rise in head flattening that occurred, massive rise, okay? Yet we did not see a concurrent change in the cognitive function, cognitive profile of people in the Western countries. And so it's hard to make a claim that this somehow is causing some kind of brain issue. In terms of facial asymmetry, crossbite, jaw asymmetry, things like that, the same argument applies. There are studies that show early on plagiocephaly can cause crossbite and some facial asymmetry. We know that because, of course, that shifting of the ear forward, the TMJ moves forward. You can see that. The question is, does that persist over time? And like facial asymmetry, the jaw asymmetry does not tend to persist over time as facial growth occurs, and that occurs for a long period of time. Young ladies, the mandible grows to 15, 16 years of age, the maxilla to about 14, 15 years of age. In boys, it's about a year later. So really long-term growth. And as these structures grow out over time, remember, they only grow kind of asymmetric during the first 4 or 5 months when the flattening is happening in the back of the head. After that, they start to grow normally. So you get this really big dilutional effect of growth over time, and that's why these things tend to sort out. So there's never been a study showing persistent crossbite related to plagiocephaly in adults after the age of mixed dentition. Similarly, there's not been a great study showing persistent facial asymmetry. So when we look at these things, you kind of have to ask yourself, where's the evidence? Where are we seeing this in the general population, knowing that 30% of people are affected in the Western world are affected with head flattening from putting their kids supine? Where are we seeing this in the adult population? Same thing with helmet wear, glasses wear. I mean, how many people do you know that can't wear sunglasses or glasses because their ears are so asymmetrical they can't fit them on, or they can't fit into a helmet? I've heard anecdotal evidence of people talking about, my child had trouble wearing a helmet. Usually it's in younger kids, so they're still not at the point where they've fully matured, the head's fully grown, but can't wear a normal helmet, things like that. That's a rarity. That's an extreme rarity. And I've been doing pediatric practice for over 25 years. I can tell you, I can't even think back to a time when I've heard anybody come to my office with that complaint. So those are the facts, okay?